Right. So today we're going to dive deep, really deep into hypogonadism. You know, that thing that happens when basically your gonads decide to, well, take a bit of a break, I guess you could say.
Yeah, basically the gonads are kind of slacking off a bit. Sounds a little funny, but it's a serious topic because it's really all about your hormones and how they're working.
Right, exactly. And we've got a lot of really good information to go through today to kind of pull apart what it all means and how it impacts your health.
It's a fascinating area, really, because when you think about it, the gonads, the testes, and men, they're not just doing their own thing. They're part of this intricate system, this back and forth with the brain.
So let's get into that. When we talk about this reduced function of the gonads, it sounds like there are different ways that can happen, different points of failure almost.
Absolutely, and that's where these terms primary, secondary, and tertiary hypogonadism come in. They're all talking about hypogonadism, but the root cause where things are breaking down.
That's the distinction. Okay, so help me understand these different types, starting with primary hypogonadism. What's going on there?
So imagine this. With primary hypogonadism, the problem is right there in the testes themselves. They're not producing enough testosterone, which is the main male hormone, and they might also have trouble producing sperm.
Okay, so the factory isn't producing enough.
Exactly. And here's the thing. The brain, the hypothalamus, and the pituitary gland, they're constantly monitoring hormone levels. So when they sense that testosterone is low, they try to kickstart the testes by releasing these hormones, LH and FSH, luteinizing hormone and follicle-stimulating hormone.
So it's like the brain is saying, hey, testes, get to work, but in primary hypogonadism, they just don't respond. Right, they're getting the signal.
But something's preventing them from doing their job properly. So you end up with a situation, low testosterone, but high LH and FSH. It's like the control center is sending out more and more signals because it's not getting the response it expects. That makes sense. So in primary
hypogonadism, the testes themselves are the problem. So in primary hypogonadism, the testes themselves are the problem. What about secondary hypogonadism? Where's the breakdown there?
All right, so with secondary hypogonadism, we shift our focus to the pituitary gland. Now think of the pituitary as kind of like middle management. It gets instructions from the top, from the hypothalamus, and then it sends out the orders to the rest of the body.
Including the testes. Okay, got it. So what's happening to the pituitary in secondary hypogonadism?
In this case, the pituitary isn't sending out enough LH and FSH. It's not relaying the message from the hypothalamus to the testes effectively.
So the testes aren't getting the signal to produce testosterone.
Exactly. And that's why, just like in primary hypogonadism, you end up with low testosterone and potentially low sperm count. But the key difference here is that LH and FSH levels are also low. It's like middle management isn't giving out the order, so the factory doesn't know what to do.
Okay, that makes sense. So we've got primary where the testes are the issue and secondary where it's the pituitary that's not doing its job. That leaves us with tertiary hypogonadism. What's going on there?
All right, so with tertiary hypogonadism, we go even higher up the chain of command to the hypothalamus. This is like the CO of the whole operation. The hypothalamus releases this hormone called GnRH, gonadotropin-releasing hormone. And GnRH is what tells the pituitary to release LH.
And FSH, right. It's the initial signal that gets the whole process going.
Exactly. So in tertiary hypogonadism, the hypothalamus isn't releasing enough GnRH, so the pituitary doesn't get the message to stimulate the testes. The result, low testosterone, low sperm count, just like the other types. But again, the issue starts higher up.
It's like the CEO isn't giving clear directions and the whole company suffers because of it. That's a great analogy. It helps to visualize.
And here's another interesting thing to consider. The symptoms you experience can actually differ depending on whether you have primary or secondary hypogonadism.
So even though the end result might be similar low testosterone, the way it manifests can vary.
Precisely. Now that makes sense when you think about it. With primary hypogonadism, because the issue is directly in the testes, you might see things like, well, mumps is an interesting example. Mumps can actually damage the testes, leading to primary hypogonadism. I never knew that about mumps. Yeah, it's not super common, but it can happen. And then there's Klinefelter syndrome, which is a genetic condition. Guys with Klinefelters often have lower than normal sperm counts, and that's because of primary hypogonadism.
Klinefelter syndrome, we'll have to dig into that a bit more when we talk about diagnosis, but what about secondary hypogonadism? What kind of things cause that?
So with secondary hypogonadism, we're looking at problems with the hypothalamus or the pituitary. There are a bunch of different things that can cause it, like tumors, certain medications, head injuries. But one of the key things to understand here is how it shows up in adults. What we call adult-onset hypogonadism.
Right, because that's who this is really going to resonate with. Yeah. So what are some of the things people might notice if they have adult-onset hypogonadism?
Well, fatigue is a big one, feeling tired all the time, even when you're getting enough sleep. And then there's depression, which can really impact your mood and quality of life.
Yeah, those are definitely things people might brush off as just being stressed or getting older.
Exactly. But if they're persistent, it's worth looking into other possibilities. And then there are the more, I guess you could say, classic symptoms of low testosterone, like decreased libido, not really feeling interested in sex as much, and then erectile dysfunction, which obviously is a big concern for a lot of guys.
Right, and those are things that, understandably, people might be hesitant to talk about.
For sure, but it's important to remember that they're often treatable, especially if you identify the underlying cause. And speaking of other symptoms, there can be physical changes too. Like you might notice you're losing muscle mass even if you're working out, and you might be gaining weight, especially around the belly.
So all those changes people associate with getting older could actually be a hormonal
imbalance. Exactly. And it's not just about how you look, it can impact your health in other ways too. Low testosterone can lead to weaker bones, increasing the risk of osteoporosis. And here's
a big one. It's linked to heart health. Yeah, the link between hypogonadism and heart health. That was really striking in the research. It's not just about sexual function.
It's about your overall cardiovascular well-being, absolutely. Hypogonadism, along with erectile dysfunction and type 2 diabetes, they're all considered predictors of heart disease. So addressing hypogonadism, it's not just about feeling better, it could actually be
protecting your heart in the long run. That's a powerful message, so let's shift gears a bit and talk about how hypogonadism is actually diagnosed. What are the steps involved?
The first thing a doctor's going to do is order a blood test to measure your total testosterone levels. And here's a little insider tip. The best time to get this test done is between 7 and 11 in the morning.
Why is that?
Because that's when your testosterone levels are naturally at their highest. So it gives you the most accurate reading.
Okay, so timing matters. And what if that initial test shows low testosterone? What happens next?
Well, they're going to want to confirm that either by repeating the total testosterone test or by measuring what's called free or bioavailable testosterone. It's just to make sure that first result wasn't a fluke.
Got it. So once hypogonadism is confirmed, how do they figure out which type it is?
That's where measuring LH and FSH comes in. Remember those hormones, the ones the pituitary releases to stimulate the testes? Well, if your testosterone is low, but your LH and FSH are high, that's a pretty good indication that you have primary hypogonadism. It means your testes
aren't responding to the signals they're getting. So hypergonadotropic hypogonadism, that basically
means high LH and FSH. You got it. And on the other hand, if your testosterone is low and your LH and FSH are also low, that suggests secondary or tertiary hypogonadism. The problem is somewhere higher up the chain, either in the pituitary or the hypothalamus. Okay, that makes sense. Now, I also saw something about seminal fluid analysis. When would that be done? Seminal fluid analysis is usually done if a guy is having trouble conceiving, if there are fertility concerns. It helps to check the sperm count and how well the sperm are moving, so it's not necessarily part of the initial diagnosis, but it can be helpful depending on the situation. Right, now, going back to primary hypogonadism, there are some additional tests that might be done to figure out the underlying cause. Like if someone has hypergonadotropic hypogonadism, they might get an MRI of their pituitary gland.
Why would they do that if the problem is with the testes?
It's just to rule out any other issues. And then there's karyotype analysis, which looks at the chromosomes. That's important because Klinefelter's syndrome, remember that genetic condition we talked about? That's the most common chromosomal abnormality linked to male hypogonadism.
So they're checking to see if there's an extra X chromosome?
Exactly. And here's another interesting thing about Klinefelter syndrome. Guys with this condition, they typically have small, firm testes, and that's different from other types of hypergonadism, where the testes are usually soft.
So that's a clue for doctors when they're examining a patient.
Absolutely. And besides Klinefelter syndrome, there are a whole bunch of other things that can cause primary hypogonadism. Things like problems with testosterone production, undescended testicles, certain medications, infections, exposure to radiation or toxins, even physical trauma to the testes.
Wow, that's a pretty long list. Yeah, it really shows how many different things can impact the testes directly.
It does, and that's why getting an accurate diagnosis is so important. Because once you know the cause, then you can start talking about treatment options.
So let's talk about treatment. What are the options for guys with hypogonadism?
Well, the main treatment for hypogonadism, especially if it's causing symptoms, is testosterone therapy. The goal is to get your testosterone levels back to a healthy range.
And how is that done?
There are a few different ways to do it. You can get testosterone injections, which you usually get every few weeks, or there are gels that you rub on your skin every day, and there are patches too. Each method has its pros and cons, so it's something to discuss with your doctor to figure out what's best for you. And I imagine there are some risks to consider with testosterone therapy. Definitely, especially for men who have or might be at risk for prostate problems like BPH or prostate cancer, testosterone therapy can sometimes make those conditions worse. So it's really important to weigh the benefits and the risks carefully. Sounds like a very personalized decision. It is, and it's not something to take lightly. But for a lot of guys, testosterone therapy can make a huge difference in their quality of life. Alright, so we've covered a lot of ground here. Let's just take a moment to recap this whole hormonal system and how it all works together.
Sounds good. I think a review would be helpful.
Alright, so remember, it all starts with the hypothalamus. It releases GnRH, which acts on the pituitary gland.
And the pituitary releases HL8 and FS.
Right. LH tells the latex cells in the testes to produce testosterone, and FSH stimulates sperm production. And then testosterone itself does a lot of important
things in the body. It's responsible for male sexual development, muscle mass, bone health.
Even mood and energy levels, exactly. And when this system gets disrupted, that's when you see hypogonadism. And just to remind everyone, there are 3 main types: primary, secondary, and tertiary, depending on where the problem originates. Primary is in the
testes, secondary is in the pituitary, and tertiary is in the hypothalamus. I think I'm finally getting
it all straight. You got it. So the main takeaway here is that hypogonadism isn't just one thing. It's a complex condition with different causes and different ways it can show up. But the important thing is that it can be diagnosed and treated.
So if you're experiencing any of the symptoms we talked about, don't hesitate to talk to your doctor. It can be something as simple as a hormone imbalance, and there are ways to address that and improve your quality of life. And, as we were talking about all this, it made
me think about something. We focus so much on the biological aspects of hypogonadism, but what about the psychological and social factors? How much of an impact do those have on a man's experience
with this condition? That's a really good question. I mean, we know that things like stress and body image can affect hormone levels. And then there's the stigma surrounding low testosterone, that whole idea of masculinity being tied to hormone levels.
Right. It's a lot to unpack. And it just goes to show that there's still so much we're learning about the interplay between our biology, our minds, and our environment.
Absolutely. It's fascinating, and it definitely warrants further exploration. So for all of you listening, I encourage you to keep digging into this topic. There's a wealth of information out there, and the more we understand about our bodies, the better equipped we are to take charge of our health.
Well said. Knowledge is power, as they say. And that wraps up our deep dive for today.
Thanks for joining us, everyone. Until next time, stay curious and keep exploring.